Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I am very happy to see you all again. I hope you've all been well and in the best of health and spirits. The first step to conquering any disease or health condition would be to understand it thoroughly. However, this is not always easy for everyone, as medicine is a complex subject and there is enough misinformation out there on social media that can really confuse and mislead you. But I'm so happy that you have joined Apollo Hospital's Facebook Live session today, where we have been aiming to simplify and demystify health for you so that you can be armed with the right knowledge and are ready to tackle any health issue without stress. Many older adults we have seen do worry a lot about their memory and also their thinking abilities. They do get concerned about taking longer than before to learn new things, or they may sometimes forget important things or forget names, so many issues. But the thing is that it is important to understand this whole phenomenon of memory loss and dementia. It is really quite normal to forget things once in a while as we age, but there is a distinction between that and serious memory problems that make it very difficult for someone to do everyday activities like driving or using the phone or finding your way home. And dementia itself is also not exactly a normal part of aging all the time. And it's not just memory loss, it can include other disorders of cognitive functioning as well, like thinking, remembering, reasoning, behavioral abilities too. So there are distinctions between memory loss, dementia, types of dementia, and then one type of dementia that we're all very familiar with, which is Alzheimer's disease. So to explain all this to us and also guide on what we can do to prevent or cure these conditions, I am delighted and honored to welcome Dr. Vijayashankar from Apollo Hospitals, Chennai. He's a senior neurologist and he's a Parkinson's disease and movement disorder specialist, particularly highly specialized in deep brain stimulation for Parkinson's disease, essential tremors, dystonia, chorea, and other complex movement disorders. Dr. Vijay is also the first person to undergo dual international fellowship training in movement disorders and deep brain stimulation from Tamil Nadu. He's the author of over 15 published medical articles in prestigious national and international journals, more than 35 abstract publications, and several presentations in international conferences, author of 3 book chapters. He's won the prestigious Silver Medal Award in Video Challenge 21st International Congress of PD and MDS, Vancouver, Canada in 2017. His case has won Joint First Prize, Registrar's Prize in Clinical Neuroscience, Dublin. He's also presented cases at the Unusual Movement Disorders session at the 2018 American Academy of Neurology at its annual meeting at Los Angeles and also at the annual meeting at Philadelphia. Welcome, Dr. Vijayashankar, to this Facebook Live session presented by Apollo Hospitals. Thank you so much for joining us here. So let us begin by asking you, what exactly is memory loss?
Thanks for the kind introduction, ma'am, and I appreciate it. Thank you. Memory loss. Memory loss is a day-to-day problem. See, many people, when they grow old, they have, as you told, that they will be having a mild memory problems. But the important thing is whether this memory problem is similar to their friends at the same age group, that everybody can develop it. But somebody who has lots of troubles in performing their day-to-day activities, such as they are forgetting where they have kept the pen, where they have kept the glasses, or where they have kept their phone, or sometimes they have difficulties in cooking, or when they are having especially the short-term memory, then that is called as a memory loss, a type of dementia, in other words.
At what age does this memory loss, even the normal small lapses of memory, at what age, or is there no particular age? When can people start expecting it?
Yeah, this is a very, very important question, ma'am. Uh, People usually develop memory loss at any age, but it is very, very common above age 65 or 70, 75, like that. When they grow older, they tend to have the tendency to develop more memory loss. But nowadays, it depends upon, we divide the memory loss into several types depending upon, is it a primary means like a degenerative diseases. Those degenerative diseases occurs at older age. There are several other causes for memory losses, some secondary causes. Those diseases can occur at even at younger age, around 30 to 40. So it is very, very important what we are dealing with. Is it a primary or secondary? So depending upon the diseases, it can occur at any age groups.
So, I mean, today words like dementia are quite well known among people. So, what is dementia then, and how is it really linked with memory loss, or does it always have to have memory loss?
Yeah. See, the memory loss is just a generic term,
Mm.
um, like a part of dementia, I would say, because in memory loss, they will have try to forget things alone. They will have, especially the short-term memory is first affected, and in over the years, they'll also have long-term memories. They also get involved, like where they have studied or where they have grown up. All those memories can occur later on. But other than the memory loss, in dementia, patients will have some behavioral changes like anger outbursts. They will be really nice, but over when they develop this dementia, they'll have that change in their behavior. They will having suspecting the people, or sometimes they will have anger and irritability. Also, sometimes they can also have poor judgment, and sometimes they will have planning. All those things can affect in dementia. So dementia is consists almost all of this problem. Out of this, memory loss is just a small part. But it's easy to say that memory loss so everybody can understand.
Okay. So this dementia, I mean, like what you already mentioned, some of the symptoms of dementia. So does it affect only older people, or does it also, which brings us to what are the types of dementia and causes of dementia? So
Yeah. As I told that it can occur in younger people also. One of the main reason is genetics. Nowadays, there are lots of genetic diseases can occur in younger people. That is another reason. Depending upon the causes of dementia, one of the main reason, we divide it into two types as we discussed. One is a reversible cause. That's very, very important. Like people with hypothyroidism, or sometimes people with vitamin D deficiency, or sometimes somebody has depression, or sometimes some sodium, potassium, this type of electrolyte disturbances can also produce dementia. Or sometimes autoimmune diseases, like diseases which is related to the immune mediated. Sometimes, yes, these type of diseases are curable if you treat it properly. Automatically, the dementia will be reversible. And the next thing is primary dementias. Primary dementia means like depending upon the older age group, like people with Alzheimer's or Parkinson's disease dementia, or sometimes strokes. There are many like frontotemporal dementia. All these things are primary dementias. Or if it is going to be a subtype, like a some secondary causes like head injuries, or sometimes medications, or even sometimes it can be uh, like strokes, or sometimes patients can have some pesticides. All these things can produce, yeah, some other reason. So depending upon what they are exposed, that could be the main reason for this memory loss.
So when it comes to dementia, I mean, before we go on to discussing Alzheimer's, uh, are there any ways really to, I mean, when we talk about preventive health and preventive health care, we do, for example, for heart disease, or we test our sugars. So we do a series of tests every year. So is there something like that which people should be aware of for dementia, something proactively to check, or are there any ways in which to mitigate it or prevent it? How do you know you're going to get it?
Yes, madam. What you have asked is a very, very important question actually, because as we discussed about there are other causes of dementia. So if somebody has a risk of like diabetes, or somebody has a hypertension, or if somebody has a heart problem, that can also, or high cholesterol, or sometimes there is a change in their electrolytes, all this can lead to dementia. So as you are told that if you are doing a regular master checkup, or like once in a year, just to find out all their blood parameters, all their body electrolytes, all these things, if it is under good control, that's the first step towards preventing or identifying or controlling the risk factors. That's very, very important. If somebody has high diabetes, or somebody has high blood sugar, sorry, high blood pressure, so there is a high chances of developing a secondary vascular dementia. So even we control these things, identifying the risk factors, so that's very, very important, are the first step towards preventing the disease.
Sure. So how common do you think now you find dementia? I mean, has it increased or is it just being diagnosed more, or has it become more prevalent now as compared to the past?
Yeah, this is like in older age, like a 50 years back or 100 years back, everybody thought if somebody develops a dementia, means they'll consider it as just a old age. It's a part of old age. They'll neglect it. The awareness about dementia is increased nowadays, and people also know that Alzheimer's is very, very common, Alzheimer's, and they also know that there are several other causes are there. So they're coming to the doctors frequently, and they're trying to know what it is. So the awareness increases the diagnosis, and the awareness leads to more investigations, and now we are able to diagnose the patients yearly, as well as we can treat them properly. That's the first thing we can, that's the reason we are seeing the people with dementia more. And the exact incidence in India, we don't have the exact incidence, because we don't have any data in India. But if you look at the Western world, like US and UK, there are almost more than 5 million people are affected with dementia. Especially, it's very, very common is Alzheimer's, followed by Parkinson's disease dementia.
So if a person comes to you saying that they have all these symptoms, so what are the investigations that are normally done?
Yeah, depending upon, first, I would like to get the proper history, because with history itself, more or like we'll come to a conclusion that, okay, this could be most likely to be Alzheimer's. Or if you examine, we can say if somebody has a slowness, or somebody has a stiffness, or if they have some tremors or walking difficulties, we know that, okay, this could be Parkinson's disease related dementia. Or somebody has some rapidly, like within 1 year, within 1.5 years, if the disease is progressing fast, we know that whether this could be a something like an autoimmune mediator, or sometimes infection related memory loss. Or if somebody has like a step by step, they have acute worsening, suddenly they will become stable, sudden another worsening, like that step by step worsening, means we know, okay, possibly this could be a stroke related, or sometimes vascular dementia. Or somebody who has a vomiting or loose stools, and we know that, okay, this could be some electrolyte disturbance, that could be the reason. So depending upon the history and clinical examination, we'll try to find out, okay, this could be the reason. So that is the first step. Then we'll order for a basic blood workup. As I told you, like a reversible causes, like I would like to do a thyroid test, or I would like to do a vitamin B12. Sometimes some infections also we need to rule out, and electrolytes, the basic blood test will do. The next step, the first thing is we like to do a MRI, because there is sometimes the fluid accumulation, what we call as a normal pressure hydrocephalus. That is also another cause of a reversible dementia. If the fluid is more, they will also have sometimes uh, urinary urgency, memory loss, difficulty in walking. All these things, problems can be there. So, okay, if these symptoms are there, okay, we know that this could be a normal pressure hydrocephalus. So, we'll order for MRI, or the MRI will also give us a clue whether the patient is having some small strokes, especially in the memory areas, or sometimes what we call it as a Creutzfeldt-Jakob disease. The MRI, sometimes we give some contrast material that can also give us a clue that, okay, this could be some infective process. First, that's the first step. Second step is we would like to do a good, thorough cognitive assessment. Like cognitive assessment means, as I told that there are several types of dementias are there. We would like to know which part of the brain is specifically affected, whether it is a front side of the brain is affected, or sides are affected, or is it more posterior. Depending upon, it will be helpful for us to classify what types of dementia it is. And also, if the patient is coming now, and we know that he is having a probably mild, after 6 months or 1 year, if he is coming back, we don't know how much is the progress, because there is no specific like assessment. If you look, if you, with just your eyes and just with the history, it is very difficult to quantify whether it is increasing or decreasing, because we have started the treatment. We don't know whether he will be improving or not. So usually this cognitive assessment, we do a lots of scales. These scales give us a clue. Okay, now he is having some approximate, just for example, I'm telling you, like 30% patient is affected. After like 1 year, if he is coming back, if you do the same scales, then we know that, okay, he is not progressing. If he is not getting adequate scores, then we know that, okay, he is progressing. So it's very, very important. Then the next level will go for a PET scan. The PET scan will give us a clue whether he has a Alzheimer's dementia, or if it is going to be a frontotemporal dementia, all these things, or if it's going to be a Lewy body dementia, which is called a Parkinson's disease related dementia. So that will give us a more clue. We would like to do a lumbar puncture. The lumbar puncture will give us a clue whether if there is any infective processes there, or whether he has any autoimmune, or if it is any paraneoplastic process. All these things will give us a clue in the lumbar puncture. So depending upon what type of dementia we are dealing with, will do the adequate investigations.
Now, coming to one type of dementia which everybody knows is this Alzheimer's dementia or disease. So, could you give us a brief overview about that? What it is, and what are
Yeah.
its main things to be aware of?
Yeah, Alzheimer's is one of the most common dementia which we see in our day-to-day practice. Alzheimer's disease usually occurs in a very old age. Some people above 60 plus or 70 plus more common. The more the age, the chance of developing Alzheimer's is more. But very rarely, some younger age of people also we see, and it's usually a slowly progressive disease. As I told you earlier, the first affected problem in Alzheimer's is short-term memory loss. They will have difficulties in, like, sometimes they'll be really very good. If it's going to be a female, they will have difficulties in the cooking. Sometimes they'll forget to put salt. Sometimes they'll put the salt or spices twice, or sometimes they will struggle to cook. Or sometimes somebody will be a really good auditor. He'll be very good in maths. So they'll having difficulties in calculating, or sometimes they'll try to forget the appointments, or sometimes they will be having difficulties. They, like, if you may tell that, okay, next week we are going to some wedding on Tuesday. So they will come back again. You told that we are going somewhere and some other day, but I forgot it. when is that? They will come and keep on, they will ask the same questions again and again. And also sometimes they will be searching for their belongings frequently. They will keep the somewhere the keys, and they will search, or again every day they will be having the same type of troubles. When the disease progresses, they will also have difficulty in judgment. Like initially, they will decide, okay, this is the problem and this is the solution. Whatever the problem, you go to them, they will solve the problem very nicely. But when the disease develops, they will have some difficulty in what the judgment will be not proper. Sometimes they'll be having difficulties in solving the problems, and sometimes they'll be having difficulty in finding the way. They'll go out, especially if it is going to be the familiar region, they'll come back and they'll have any problems. But if they are going to a new place, then they will have lots of troubles. Sometimes they don't know how to come back, they will get confused, they will be lost. And also sometimes they'll be having some behavioral changes. They'll be very angry, irritable, and somebody, if you are trying to point out, okay, you have this problem, why don't be careful, they'll not like that one, they'll get irritated, and I know what I'm doing. The biggest problem is people with Alzheimer's doesn't know that they have a dementia. That's one of the important thing. They know that they have some, in the initial stages they know that, okay, I have some troubles, they will say that, but usually they don't know that they have a dementia, so they will struggle a lot. The other thing is, sometimes when the disease advances, they'll have some hallucinations also sometimes. Especially these type of hallucinations can occur in Parkinson's disease dementia, such as dementia of Lewy bodies. But we often see in Alzheimer's also, like people will like hallucinations, means especially in the evenings or especially in the night time. They will say that, okay, nobody will be here, but they will see somebody is there, what is called as a visual hallucination. They will say that, okay, somebody is there, some children is there. Sometimes those type of hallucinations are very, very common in people with Alzheimer's.
So is there, like, because we have heard that there are not really any treatments as such for Alzheimer's, but what is done generally to, is there something that can halt the spread or reduce the severity of the symptoms if somebody is diagnosed with Alzheimer's?
Yeah, there are two things I would like to prefer to divide it, ma'am. So whether first thing is whether there is any preventive or controllable, that's very, very important for everyone, because Alzheimer's doesn't have a cure. We have a couple of medications that is helpful, but the important thing is, I would like to say is controllable things. First, try to control the diabetes or the risk factors like hypertension, or sometimes if it is a cholesterol, try to control that one. And also there are medications like what we call it as a donepezil, or sometimes rivastigmine. All these medications are there. These medications are trying to control the disease progression. These medications are try to help the slow down the disease, or try to, for some, like for a couple of months or for a couple of years, it will try to help you to reduce the dementia. There are a new drug which is called as aducanumab, which is released in US, which is a new drug which is released after 20 years of research. This drug is shown to give some benefit, but not for all people with yearly disease. There is some benefit it has shown, but this drug is also will not produce any cure. This drug is also used to control the disease process. So it is very, very important to diagnose the disease early and try to control, change the lifestyle. That lifestyle changes with medications will help us to control the progression of the disease. So that's very, very important to control the disease progression. That's what I'm keep on asking. So every patient used to come to my clinic, they will ask me, is it a way to control, like cure the disease? Unfortunately, I'll say that I'll explain all these facts, what all we have in front of us, and I'll say that these diseases cannot be cured, but it can be controlled.
So obviously, early visit to the doctor at the sign of these symptoms will really help, isn't it? So the other thing is, one has heard that, I mean, things like aspirin and other preventive measures in terms of, people, I mean, before developing any of these symptoms, do any of these actually work? Is there something that somebody can take in their daily life or something which, I mean, apart from controlling things like the sugars, the lipids or the BP, anything in our daily life, does that help in uh, preventing these or trying to, like, or any supplements that one must take? Is there anything like that?
Um, this is a very, very interesting question, ma'am. Like as I discussed with you, there are many types of dementia. That's one of the subtype of dementia is called as a stroke related, which is a vascular dementia. People with stroke or people with heart diseases or the risk factors for a stroke is like a diabetes, hypertension, cholesterol, smoking, or sometimes hyperlipidemia. So heart diseases. So if somebody has these risk factors, they have the tendency to develop strokes more compared to other people. If somebody has these type of risk factors and they are above 65, 70, there is a chance if they have like a sometimes there are a concept earlier was there, try to start the aspirin earlier to prevent a risk factor. Somebody who has a heart problems, if they have some angina, yes, it is possible to start aspirin, so that can also help us to avoid a stroke. But unless otherwise somebody doesn't have a stroke, I would not recommend aspirin to just as a prevention for dementia or vascular dementia. So about the supplements, the important thing is there are lots and lots of supplements that has been tried to control the disease process, but all the supplements are just supportive, but it is not proven to control or not proven to reduce the progression of the disease. So the only thing which is proven to control the disease process is two things. One, regular exercise. So do at least 40 minutes of exercise. Preferably, I would say that just try to rotate the exercise or change the exercise. Like one day is walking, one day like aerobic exercises, or sometimes you can do some gymming, whatever you like. So whatever, depending upon age, whatever is depending upon your body tolerates. So change the exercise, learn new exercises. That's very, very important. Two, the Mediterranean diet, which is very, very important. We are keep on talking about Mediterranean diet. Mediterranean diet has lots of fruits. So that also you can change the fruits, like one day apple, one day orange, one day grapes, one day papaya, like that. You need to change the fruits. And also you should take more and more vegetables. Like just for simple, for people to understand, we'll say that 1 cup of rice means 1 cup of vegetables. That's more important. And also the small grains and like pista, badam, walnuts, this type of food can increase the memory problem, reduce the memory problems. And also you can take fish and prawns are good. You can take at least 2 times a week, and you can chicken means probably once a week, and avoid mutton, like a meat and sweets. That's very, very important. Or you can keep it very, very rarely, and take more and more water, at least 2 to 3 liters of water, depending upon your the weather situations. And also try to learn new things, like somebody like lots of puzzles, or sometimes you can crosswords, or sometimes you can do some new music, or try to learn new things, new language. So try to activate multiple parts of your brain. The new things always stimulates the brain. So always keep yourself very, very active and try to learn new things. This will always reduce the progression of the disease. That's very, very important.
What about alcohol consumption and smoking? And today we hear there is substance abuse also prevalent in some areas. So, what role do they all play in the development of dementia?
Yeah, this is a very important question, ma'am. People always, especially the younger people, whenever I talk about the diet, the next question they will ask me is, can I have alcohol? So there are two types, I would say. If I say you can take alcohol, people will take it liberally. So they will try to take more alcohol frequently. They'll say that, okay, doctor advised to take. So I'm happy to, he has given the license to take alcohol. So that don't mistake that one, that's very, very important. So you can consume alcohol like something like a wine, one like a 1 cup of wine once or twice a week. That's fine, not more. But don't take it too much. That's very, very important. So a slight wine is fine. Another thing is about the smoking. Smoking is a biggest risk factor because it can produce, the smoking is one of the risk factor to develop a heart attack or the stroke. So that can also, a small strokes can worsen the dementia. So I would prefer to, I will always advise them to avoid smoking. Third thing, as you are told, the drug abuse, that's the biggest risk factor, especially among the young people. They will have consumed all the drugs, and it increases or it induces dementia in many people.
So I think we have covered most aspects of memory loss, dementia types, and also about Alzheimer's. I think this was a most fruitful and illuminating discussion. So viewers, I'm sure you also found this very, very enlightening. So thank you, doctor. And please remember, viewers, that if you have any more queries and if you would like to seek medical help, we are always there. We are present in several cities and always accessible and available to assist you anytime. And you can also put in your comments or queries or any other clarifications that you might need on any of our social media channels. You can reach out to us. And you can also continue to follow our social media pages, our YouTube channel, so that you know what's happening and what's the latest in the field of healthcare. So remember that if you or a family member or a friend has problems suddenly remembering things or thinking clearly, I think it is very, very important to take it seriously and talk to a doctor, because a thorough check, as doctor suggested, and an evaluation is very important. Early diagnosis always helps, and knowing the issue is always better than just living with just stress and fear and not knowing the reason for our health issues. So do take care, do seek help, and see you all soon. Thank you and namaste.